today we will be doing the first physiology topic on Layla Teachers, and it is about the electrical activity of the heart. We will be speaking about three different things, starting with the normal ECG, which stands for electrocardiogram pattern. And this is what it looks like. You need to remember this very well. So you have a small peak, and then you go down, then you have a very large peak. Then you go down again, and you have another small peak. Alright, and this starts for P, Q, R, S, and T. QRS is a complex on its own as well. So the ECG is a graphic representation of the electrical activity of the heart. It all starts with the sinoatrial node, which is in the right atrium and is the natural pacemaker of the heart. Now let's talk about each letter. So P is for the depolarization of the atria, both the right and the left atrium. PQ interval is for, it travels along the atrioventricular node. Along the bundle of His, and then you have Q, which is it travels along the depolarization of the interventricular septum. Then we have R, which is a large peak for the depolarization of the ventricles, so the right and the left ventricles along with the apex. Then we've got S, which is also depolarization, but for the posterior walls of the ventricles. And finally we have T, which is not D but repolarization of the ventricles. Now we speak about the ST segment. So it is about the depolarization of the entire ventricles actually. So the complete depolarization of the ventricles. Then sometimes we've got a small U wave after the T, which is for repolarization of the pupillary muscles contained within the heart. And that would be the normal ECG pattern. That is very important, so please do remember the structure and what each letter stands for. Now we shall move on to the second part of this video, which speaks about the uses of the ECG. So we can find out about heart rate, about heart rhythm. We can also find about some kinds of diseases like heart attack, myocardial infarction, like ischemic diseases of the heart, abnormal electrical activity of the heart. About coronary artery disease. Now we will move on to the third part of this video, which speaks about the leads used for ECG. So we've got two types of limb leads. We've got the bipolar ones and we've got the augmented ones. Both of them have 3 leads are used, and we have for bipolar we have lead 1, which goes from the left shoulder to the right shoulder, and it's the left one is positive and the right side is the negative terminal. Then we move on to lead 2, which is from the right shoulder to the right foot, to the left foot, which is right is always negative, and the left foot would be positive, and the left foot is always positive. It just makes it easier to remember. Now, lead 3 would be from the left shoulder to the left foot. So as I said, left foot would be positive and the left shoulder would be negative in the third lead. Using the leads, we use it with these terminals to find the voltage difference, and that's what gives us the pattern that we observe in the chart. So as you've as you can see, in the bipolar limb leads, we've got 2 charges. The placement of these leads looks like a triangle, and this triangle is known as the Einthoven triangle. And then you've got the augmented limb leads, which have only one charge. It has only one charge. So you've got a central terminal, and obviously you've just got one charge, and they're all positive, and they enter or they exit into the central terminal. So you've got AVL, AVR, and AVF. So L is for left shoulder, R is for right shoulder, and F would be for the foot, which is the left foot. Now we have a third type, which is known as the pre-cordial chest leads. They're not limb leads anymore, but it's a chest one. We've got 6 of them. They are named as from V1 to V6. So they've all got a position, which I will mention. V1 and V2 are in the 4th intercostal space and on each side of the sternum. So V1 is on the right side and V2 would be on the left side. We'll come to V3 later. So V4 and V5 are in the 5th intercostal space. The difference is that V4 they're both on the left side though. The difference is that V4 is in the mid clavicular line and V5 would be next to the left axillary or axillary line. V6 is also in the 5th intercostal space, but it is in the mid axillary or auxiliary line. V3 is in a straight line between V2 and V4. That would be it. Thank you for watching.